Working in the emergency department is a unique experience. Patient care can be simple and quick, or critical and extremely time-consuming. With the many urgent care springing up, it seems like on every other block, the volume of the simple and quick patients seen in the emergency department has become less and less. What's left over is an ever-increasing number of higher acuity patients. With this higher acuity comes further testing, medications, consults, all of which slows throughput and increases patient wait time. Throughput in the emergency department is an essential element in patient care. Patient flow through the ED must be constant, or there could be serious consequences, as well as irate patients and their families. Disgruntled patients are now commonplace in the emergency department waiting rooms. According to McGee and Kaplan, overcrowding in the emergency department is a nationwide problem. This project examines the use of the adult gerontology acute care nurse practitioner in the emergency department. A literature review has been conducted to assess both the pros and cons of utilizing the AGACMP in the ED setting. The target facility is a 20-bed emergency department in a hospital that has a cardiac cath lab, a dialysis unit, and is a stroke center. Because of its acknowledged expertise in these specific fields of medicine, critically ill patients come to this ED from several different counties, despite the fact that the hospital itself is relatively small compared to other area hospitals. The target ED only has one physician available for most of the day, 14 hours of the day to be exact. There are currently no residents, no physician assistants, nor are there nurse practitioners utilized in this ED. A literature review of options used by other emergency departments for the use of the AGACMP to aid in the throughput in the ED has been evaluated, and recommendations for the target facility will be noted. Throughput is the movement of patients in and out of the emergency department. With the increase in the acuity of patients seen in the ED, wait times are longer, which causes patients to become extremely irritable. Quick triage is the ability to triage, assess, diagnose, treat, and discharge patients in a quick fashion. Bridging orders are generally a short set of admission orders for patients written by the ED physician on behalf of the admitting doctor. Utilizing the nurse practitioner to provide quick triage to those patients with less acuity and write bridging orders for those patients admitted to the hospital should decrease wait times and increase patient satisfaction. Having the AGACNP incorporated in this quick triage system will enable the ED physicians to provide the more critically ill patients with the care they need. Given the critical patients brought to this ED, the AGACMP would be able to provide the ED physician with the much needed extra coverage. The emergency department is a very dynamic setting. It is constantly changing and no 2 days are ever the same. Having several critically ill patients coming in at the same time with only 1 or 2 ED physicians available can bring throughput to a grinding halt. Being able to facilitate patient flow will be beneficial to both patients and staff alike. The slower the throughput, the more patients the nurses are caring for, as there is no patient-to-nurse ratio in this department. The use of the AGACMP is expected to help alleviate the increased wait times and decrease the number of patients that leave without being seen. According to Hayden, Burlington, Thompson, and Sobel 2014, workforce shortages of emergency department physicians, along with poor access to primary care, have increased the need for hospitals to use advanced practice providers to help deliver emergency care. The target ED does not staff its own emergency department physicians. Rather, they outsource to a company that pays their ED physicians on a pay-for-performance basis. Nurse practitioners are assuming more responsibility and accountability in providing health care. The effectiveness of the nurse practitioner role has been well documented with increasing patient satisfaction and delivery of quality care. In the ED, nurse practitioners are performing more and more procedures. With frequency comes confidence for both the nurse practitioner and his or her ED staff. Incorporating a fast-track system staffed by the nurse practitioners for non-urgent patients has been shown to be an effective system of care. One study, however, by Tsai, Sullivan, Gindi, and Camargo did find that unsupervised practitioners provided a lower level of care and recommended that the practitioners receive better training and work in collaboration with an ED physician. Use of the AGACMP should promote faster patient throughput, whether the patient is admitted or treated and released. The ED management teams, physicians, and AGACMPs should work together to develop policies for the role and scope of practice of the AGACMP in the ED. The Toyota Lean Production System is a conceptual framework created by the car manufacturer to deliver high-quality, low-cost products with faster manufacturing time. In the healthcare field, this concept of lean requires management to facilitate, mentor, and coach staff members to identify and solve problems. This concept will enable staff to express their views on the issues they see firsthand and offer solutions to those issues. Future research should include a standardized role and scope of practice for the nurse practitioner in the ED. Having a common set of procedures will help educators prepare the nurse practitioner student to excel in their future careers. Another area of research would be an evaluation of the use of the nurse practitioner in the ED. Evaluations would consist of a cost-effective analysis, an analysis of wait times, and surveys of patient satisfaction, as well as patient outcomes. The outcome of the literature review has enhanced this author's belief that a nurse practitioner working in the emergency department would be beneficial to healthcare systems in general, but more specifically for this target facility. Education, support, and trial and error will help advance the future roles of the nurse practitioners in all fields of nursing. The overall goal of this project is to have a nurse practitioner employed by this target facility. Utilizing the AGACMP for the quick triage system would help throughput in this emergency department. However, due to their pay for performance reimbursements, the ED physicians are not willing to share the quick triage patients. On the other hand, the night physicians that are paid on an hourly rate and work alone are for the incorporation of the AGACMP, especially for those nights that generally have a higher volume of patients. The career trajectory of this author is continued work in the ED, but on a much higher level of care. Thank you.